is Anne Baltzer, and I'm the manager of the Early Start programme in the Oxnard office. My colleague, Dina Burnaby, is manager of the Early Start programme in the Simi Valley office, and it's nice to put faces to names and names to faces here. This particular office serves about 1,000 children in Early Start. At the moment there are about 500 children being served over in the Simi Valley. I just want to, before I get started on what the IFSP is and who is eligible, I just wanted to kind of give you an idea of what our philosophy is, and we sort of drive this home to parents and we try to drive it to the community. We are not a medical model. We are an educational model, and our goal is to educate parents. And underlying that is that we have about an hour, 2 hours a week to work with children. And so if the parents buy into the intervention and incorporate the therapeutic techniques into a child's play and routine, then they're afforded multiple opportunities during the week for successful outcomes. And we also provide our services in a child's natural environment or in the community. Am I talking too fast? Okay. So what is Early Start? It's a federal and state funded program, federally under the Individuals with Disabilities Education Act, and statewide under California Early Intervention Services Act, and the regulations may be found in Title 17 under the California Code of Regulations. Early Start is a system of early intervention services provided to families and infants through 21 regional centres in the state. It's a partnership between agencies, between behavioural health, public health, human services, and many, many more agencies. And not the least of these partnerships is the Family Resource Centre. Laurie Jordan and her staff are down here from Rainbow Family Resource. Family income is not a factor for eligibility, although families may use their private insurance if they so wish. Who is eligible? Well, children from birth to 3 under 3 main criteria. And this sort of how I conceptualize it is infants and toddlers who are referred to us and who have a developmental delay in one of the 5 domains. We consider that delay to be a 33% delay. That's the cutoff for eligibility under developmental delay. The second category is established risk, and that exists when a child's condition has a known etiology of resulting in a developmental disability. And these conditions must be diagnosed by a physician. And the third category is under the high risk, where a developmental disability exists when a multidisciplinary team determine that a child has a combination of 2 high-risk factors, and that's listed in the handout. So typically this would be children who are prematurity of less than 32 weeks and perhaps being on ventilator therapy for 48 hours or more. There are many, many factors that can be considered. I think you have them in the handout under high risk. Okay? So Tri-Counties Regional Centre is the lead agency for the delivery of Early Start services, and the second lead agency is the Department of Education. I'm not going to get into very specific details about that because I think it can be really confusing. The local education agencies serve children who have solely low incidence, either vision impaired, hearing impaired, or orthopedically impaired. So how do we get all of these referrals to Early Start? The majority of the referrals we receive come from primary referral sources such as youth clinics, schools, and actually we get many referrals from families. The majority of the children we serve, or the majority of the intakes we receive, are children who have a developmental delay. The high-risk category and the established risk category typically come from the NICUs, and they're referred from the NICUs. Okay, I think we'll move on to the IFSP, and I think you've asked me to speak about the Individualised Family Service Plan and sort of what the flow is. When we get a referral, it's generally called in, and we assign a service coordinator to the case. That service coordinator makes contact with the family and sets up a home visit. And during that home visit, they obtain a consent to evaluate the child, to obtain medical records, and get a lot of background information from the family. We typically do that in the family home. The second step is that we contract with a provider, in most cases, to evaluate the child. And the provider also does that, for the most part, in the home. They look at the child's strengths, the parents' concerns, and I think it's probably fair to say, one of our providers is present here, that the evaluation tools that are used are kind of depend on the individual providers. Typically Bailey's, Gazelles, Help Hawaii Early Learning Profiles are used, and these evaluate the child's level of functioning. They complete that report and submit it to us, to the regional centre, to determine eligibility. And with a review of the health records and information provided by the parent and the evaluation, then our multidisciplinary team determine eligibility. So, as I said, for the most part, we're finding that the majority of children are relying on the evaluations to determine eligibility. We can establish eligibility with medical records on high risk and on established risk. If I'm forgetting anything, I welcome Dr. Steve Graff, Laurie Jordan, Pablo down here to prompt me. Okay. So, assuming that the child qualifies and meets our eligibility criteria, then we meet a second time with the family to develop a plan. And that is known colloquially as the IFSP. And I brought an IFSP with me to sort of guide me and direct me as I deliver this. We really try to focus on what the parent hopes to get from this and what their concerns are. So the parent drives this. We typically don't take goals straight out of developmental evaluations, because a parent will rarely say, I would like my child to have a refined pincer grasp. It will usually be something more like, I'd like my child to be able to feed himself.